welcome to you.
Thank
I know
you,
we've had
Amber.
you on
It's
a
good to be
couple of
here.
times before. I love it when you're here because I feel like every time you come, there's always something new for us to chat about, and something I'm like, wait, you guys can do that? This is how this works? And today's is no different. This is the liquid facelift.
Correct.
How does this work?
Well, in the past, we've talked about non-invasive ways to sculpt the figure, and now we're going to be talking about the face.
Okay.
And the liquid facelift is a term that was coined to describe the ability to add back that youthful volume and fullness and erase those surface lines by minimally invasive, painless, literally, injections.
And when she says this, you guys, like minimally invasive, we're talking no surgery.
Right, no surgery
required. Something you can do over your lunch hour.
Right. In the office, we do use a topical numbing, so you do not feel the injections.
Okay.
And one of the things folks sometimes don't realize is that the aging effect that the face experiences is in large part due to loss of muscle mass, bone mass, as well as,
and I think we have some pictures of that too.
The fat. You can see from these diagrams that this youthful face on the left has a lot of very plump fat tissue, and that does shrink and atrophy as we go through life, as well as adequate muscle, and even the bone in our face does deteriorate with age. So with these liquid substances, both commercially available fillers, as well as sometimes a patient's own fat or plasma, we can restore that wonderful youthful fullness that someone such as yourself that's still young. And
oh, I don't know. I see those little wrinkles creep up every day.
Yeah, well, we can help you with that.
Well, I know that you do get people. I would assume of all, and when I say all ages, of course, I don't mean, you know, teens, 20s, but I mean all ages as in 40s and up,
starting in
mid-30s,
40s, 50s.
Okay.
People usually start with, part of that liquid facelift is Botox and various substances that will relax those muscles in the upper face that come with furrowing the brow or smiling or raising your eyebrows.
And I would imagine too, you told me earlier, this is just a couple of treatments, right, that could potentially last years.
Yes, yes. Some of these fillers, some of the longer lasting ones, such as Sculptra, and Voluma and Restylane Lift, will last up to 3 years. So
typically fine lines, wrinkles, and maybe sagging skin, I know, and we're seeing here of someone actually getting it done.
Yes, so as you can see, she's completely comfortable, and we draw out the areas where the patient needs to be injected, and we put topical numbing on the face, and then with tiny needles we inject to restore volume subcutaneously. There are substances that can also be injected in those fine surface lines, not only Botox and Dysport, but also some thinner fillers that will erase.
And I would imagine that obviously each person is different. Everything is individualized. They just come in for like a consultation, and you guys develop a plan?
Yep, we develop a plan, and we tell them, they tell me what bothers them, and I tell them what my opinion is, what would benefit them the most, and we talk about their budget and their goals. And we can do it in stages, or we can do a lot all at once, and then, you know, continue to add
whatever's best for them.
Yeah, we tailor it very specifically to each patient's needs. And
well, I know boothdermatology.com for all of the information and so much more. And just give you guys a call. Once again, if you're interested, give them a call.
848-2427, boothderm.com.
Okay. All right, Dr. Booth.